Have you had your knee replaced recently? Are you still struggling with your knee bending, your knee straightening, your leg muscle strength? If you are, you're still struggling with getting around the house, getting up and down the stairs, in and out of the car. Of course you are. Everybody is 2 to 4 weeks post-op knee replacement. The question is, how do we progress from here? Do you keep doing the exercises you got at the hospital? Do you keep doing the exercises you got day 1 of physical therapy? Maybe, but probably not. So for my patients, I had a couple in the office today. They're, again, 2 to 4 weeks post-op. They're getting better. Their range of motion's getting better. Their strength is getting better. Their pain's going down. They're getting around a little better. But they're still quite obviously struggling. How do we progress? Today, I'm going to demonstrate what I call my Phase 2 home exercise program for post-op knee replacement. So as I mentioned, we simply ramp up the intensity of our bending, our straightening, and our muscle strengthening in order to accelerate our progress. Hey, before we get started, I just want to remind everybody, if this content is helpful for you, click that like button, click that subscribe button. Also, if you're going through rehab after a knee replacement, I'd be curious as to what you're struggling with, what exercises you're having trouble with, what everyday activities around the house you're trying to figure out how to recover from and having some trouble with. I'd appreciate any comments. Anyway, first exercise, we're going to work on knee bending. And I mentioned in our Phase 1 video, which I'll link in the description, knee bending is obviously super important. When patients don't have a great result after knee replacement, it's almost always because they don't regain bending. So one of our foremost goals. Okay, so for this exercise, you need a rolled up towel, rolled up the long way, and you're simply going to lay down, probably in your bed, put the towel around the shin. So the higher up the shin the towel is, the easier the exercise is. The lower down the shin, the more leverage you're going to apply to the knee. So start out, towel high in the shin, and you're simply going to pull the knee up towards your chest at a moderate pressure, a pressure you can sustain, can tolerate for 20 to 30 seconds. After 20 to 30 seconds, give it a break. Repeat 5 times. Okay, our next exercise we simply call a heel prop knee extension stretch. You want to lay down? Okay. So we're simply working on knee extension. So pretty much put the heel up on, in this case, my bench, another chair, the ottoman, and basically sit here as long as you can. It can get pretty uncomfortable. If you can do 5 to 10 minutes, that's pretty good. Longer is better. Do something to distract yourself. Be on your phone. Be the one time we'll tell you to be on your phone. Watch TV, read, do something to distract your mind, and just try to let the knee hang down. And that's the hard part. It'll be uncomfortable. You'll want to hold it up. Do your best to let it relax, let gravity do the work. And again, pretty much as long as you can do it, 5 minutes plus would be best. Our next exercise, we're working on our side hip muscles. Our side hip muscles are super important for walking, squatting, getting up and down the stairs. So we're going to take this band, and if you're my patient, I've given you this band. You simply put it around the knees, lay on one side, lift up, hold for a moment. So my hurt side is my right side in this example. Come up, hold for a moment. 10 to 12 repetitions. That gets pretty tiring. You should feel it right in the side of your hip. It gets pretty fatigued. The next exercise, we're working on thigh and hip muscles, basically your butt muscles. So we're using our band again, okay? Band around the knees. We want some outward pressure in that band, and then simply lift your butt up, hold for a second or two, come down. Up, hold for a second or two, come down. Approximately 10 to 12 repetitions. Okay, the next exercise is simply a banded squat. So I got this band around my knees. I got a chair behind me. So again, in our Phase 1 video, again, which I'll put a link to in the description, we did just kind of mini squats. Again, you might imagine right after you've had your knee replaced, doing a deep squat is not going to work. Well, again, now some time has passed. We've gotten a little better. We're getting a little more intense with the exercises. So band around the knees, feet apart about approximately shoulder width. Squat down. If you can get to the chair, great. Up and down. It's important to be able to do it in a controlled manner. I'll often say to patients in the clinic, pretend there's eggs on the chair and you can't crack them. So stay controlled. Now, if you can't get all the way to the chair in a controlled manner, simply moderate the depth of your squat. Up and down 10 to 15 times. Now notice I'm kind of sticking my butt out when I squat. I'm not, as we often say, squatting into my knees. We're trying to engage the quadriceps. So kind of stick your butt out as if you're about to sit in the chair. You're just going to stop partway down. So that's my phase 2 home exercise program for my post-op knee replacement patients. These are the exercises I really tend to use the most to help accelerate people's progress with their knee bending, their knee straightening, their leg muscle strength. I hope you found this video helpful. Click the like and subscribe button, and I'll see you in the next video.